So it's Mike Gow here with Interdental TV, and it's a great pleasure to be here today with Anne O'Donnell. Now, Anne, you've got a couple of practices in Ireland, is that correct?
Yes, yeah. So I'm here in Glasgow for a quick visit with my team for our Christmas party.
Wow,
so,
but you're coming to Ireland, coming to Glasgow from Ireland for your Christmas party. Wow.
Yeah, something different. So yeah, I've got a clinic in Mullingar in Westmeath. We've got two clinics, and we have a mixture with general dentistry, specialist services. So we pride ourselves on kind of looking after from everybody from young to old, and we try and make it as pleasant an experience.
Of course.
And to give people the best oral care.
So how close are the two clinics then? Are they, is it in the same town then?
It's in the same town, yeah.
Okay. And how many other clinics are in the town then?
There are probably 5 other clinics. Yeah. We started with one, and then we were offered a second clinic in a new medical centre, and it just made sense to actually keep both. And one is geared more towards orthodontics, children, and the other is more towards general dentistry and the specialists.
And is that the one that's in the medical centre, the specialist?
Okay,
excellent. So I guess there's a bit of referring that goes between the two clinics.
Absolutely, yeah.
Excellent. So is the Christmas, I want to ask more about the Christmas night out. This is fascinating. So is it both clinics that are coming to Glasgow? What made you choose Glasgow for the night?
One of our girls, actually two Scottish girls, but one is from Troon, and she said, right, we're going to go to Glasgow, we want to go somewhere different. So here, this is
You know it's going to be absolutely mental.
I know, we didn't realise that the cup final was on, so we're going to have to make sure that everybody gets home safely.
Of course. That should be interesting. So I know, obviously we've known each other for a while now, and through various kind of shared interests. And I know you've got a great interest in helping anxious patients.
Yes.
And I believe there's a project that you've been working on recently to do with helping anxious patients.
Yes, yeah. So we originally met with the DigiCheck, the wand, and then the Alpha Stim, which we use, which a lot of our patients use in the waiting room, and we've had great results with it. And now we've got the Kit Cam, which is it's very simple. It's a button. I should have brought it with me, but it's a small device. And the patient actually holds it, and we've got a little unit on our dental unit. So the patient, if they want the dentist to stop, they literally press the button, and it lights up and it makes a sound. So rather, it's easy to say put your hand up, but I think when people actually have something to hold, it just gives them a little bit more control.
I think so.
People feel when they lie back, they just they've lost that control. So kids really love it, and they actually don't use it that much, but I think it's just the feeling that they have it, and the same with adults. So it's a very simple device, but it's very effective.
Well, what I like about things like that, obviously people have, and the stop signal can work very well, but I think people sometimes have had that stop signal given to them before, but maybe a dentist hasn't stopped. So when you tell someone, look, put your hand up and I'll stop, there's maybe not the belief. So having something different in you and that you've invested in kind of demonstrates that, look, we take this seriously, and if you press the button, then we stop.
Exactly, and I think parents are really impressed with it, that at least their children have a little bit of control. And as you say, it just shows that that we care that little bit.
Of course.
Kid Cam are very good. They give you information to put on your reception desk. They put you on the website, so it lets people know. It's all these small things that just so that people know from the first hello that you're looking after them.
Of course, absolutely. Well, what's interesting is a lot of dentists as well will talk about all that'll happen is the kid will press the button every 30 seconds and you'll never get the job done. But the research actually shows the more control you give the child or give the anxious patients, the more control they know they have in their hands, the less likely they are to press it or stop the treatment, and actually the faster you get on with the job and what you want to do.
Yes, and we provide sedation, but you know yourself, that's not a solution.
Of course.
You need to have patients feeling that they've achieved something and that they're happy. So
it's that balancing act between the kind of behavioural techniques and the sedatives.
Yes.
You know, if the behavioural techniques alone are successful, then that's great. But even with sedation, you definitely need the support.
Yes.
To get through it. So, you know, certainly that style of technique can be massively effective for folk. There's other some patients find that a release type signal is sometimes more effective than actually pushing it. Do you know, is there a way that the device can you're okay while you're pressing it, but you're not until you release it? Is that something that's possible with it, do you think?
No, because it actually makes a noise.
Yeah.
Unless you got the noise.
Okay, so it turns it on.
Yeah.
I might edit that bit out. That was more just my curiosity about that, because I know there are some patients who, especially if they've been abuse survivors, that find it hard to give a signal, and actually more like a dead man switch works well for them. So actually having something that they're doing that says they're okay, but when it stops, it means they aren't.
Right.
So it might be interesting to maybe speak to them and see if there's a way of doing that. But as I say, I might take that bit out actually.
Okay.
Just my stumbling thought pattern.
Okay, no problem.
Okay, so
and then I suppose we go from patient care, and no matter how good our patient care is, at the end of the day, it's home care.
Okay.
And I suppose I've been in the business a long time, and I see people coming back and they still have issues, recurring problems, not just from not being able to look after what we've done for them or what they've had done. So that's why I've looked at things like the triple bristle toothbrush, which is a triple-headed electric brush.
Okay.
It's developed originally for special needs, and then they discovered, well, most people only brush for 45 seconds, and if this can do it, and most people miss one particular area all the time, just get over that. So we've been supplying that to patients for the last year, and really had some really good results with it.
Well, that's interesting, because I recently was speaking with somebody, and certainly patients that have debilities or are unable to brush their teeth, so folk that are paralysed or they're relying on nursing staff to brush their teeth, I would imagine that type of brush would be very, very useful.
Yes, it makes it much easier for a carer.
Because staff sometimes don't have long to brush the patient's teeth if they're in
no, and can you imagine if you were in a home and nobody brushed your teeth or didn't brush them properly? No, it isn't nice. Yeah. We've teamed it with Biomin, the toothpaste developed in Queen Mary University, which has it's based on a bioglass, but it releases fluoride over 8 to 12 hours, and we're getting really good results with the two. But the Biomin actually binds to the tooth, so and I think both of them actually give people a nice. Their mouth feels nice and fresh, so that kind of encourages them to brush more. And then, the plus to that then is that they've also got really good oral health. And I mean, we know now all the links to all the systemic diseases. So the healthier people are, the healthier.
I think also in what you're saying, in that particularly vulnerable group where folk are in perhaps residential care, or they've got limited ability to brush for whatever physical or mental issues. And I think those are the ones that when they do need dentistry, it then becomes a much bigger deal. It's not just a simple case of doing a filling or removing a tooth. The whole process becomes a lot more significant.
Yes, even moving them from where they are, and then out into a different environment, and
So prevention is obviously important anyway, but in that group of patients even more so. That's fascinating to hear what you're doing with that. It's so important.
Well, I think we become very focused on treating disease,
of course,
and I think we just really need to start thinking about prevention as well.
Absolutely.
And then I suppose our other connection has been de facto,
of course.
So which is your
indeed
what we call it, online listing. Sorry. Look, de facto your online listing. We're delighted to be on that listing for Ireland, and I think so many patients, the first thing they do is Google, look, and it's great to be able to see everything in one place.
Indeed.
And I think you're linking it now to the online shop, making it easier for patients.
Yeah.
I think you've got a winner there.
Absolutely. If anybody's not already on de facto, it's very easy. Obviously, as Anne's saying, you can go in. Your clinic probably is already listed on there,
yes.
but you can go in and claim your page and promote it and fill out all the details. So when patients are going in, they'll actually find you and you know they'll know the types of services you're offering and choose you because they know that you'll look after them.
Yes.
So you're using the shop as well then, your dentistrecommends.com?
We are about to start using it, so looking forward to that.
No, we've got on very well to here actually, but, you know, the products and the things that we used to write down on a piece of paper and hand away to a patient, we can actually send them a direct email and know that they're going to be collecting exactly the right products.
Yes,
it's good.
Because a lot of the time people forget, you know, they walk out our door with the best of intentions, and then life starts again.
Absolutely.
Whereas at least if they've got that email and they know exactly what to get.
They know what to get, and it means you don't have to hold the stock as well, especially for some of these higher-end products, the water picks and the sonic toothbrushes that actually take up a lot of cash flow if you're going to buy stock in.
Yes.
And you then get to worry about if you've bought a whole load of these things, where do you store them, and you know, are some of them going missing? Are you giving them away? What's happening?
We're not set up as retail shops, so
Absolutely.
you know, but yet we need to tell our patients
about
what
the right
they need.
things. Indeed. Oh, that's good. So I'll be interested to get your feedback on how you got on with that. But we're certainly really enjoying using it.
Good.
Here. So what's next then? There's always, every time I speak to you, there's always great ideas and things that you're doing, and I always feel really enthused after speaking to you because there's so many great ideas that you're working on.
We are looking as well at a little bit of teledentistry.
Okay.
So maybe providing patients with out of hours emergency cover, reassurance. You know, let them know what they can do until they get to it and how they can book in. So again, I think the de facto link, we're hoping to be able to link in something there.
I mean, obviously teledentistry, I guess like telemedicine is always going to be difficult, and if you're not seeing the person, it's very hard to give a definitive diagnosis or say what's going on. But there's so many things. I know myself, if I'm on call, you know, a good 70% of the phone calls are things that you can say, well, it's likely to be this or this. This is what you should do, and if it gets worse or there's any issues, this is what you do next.
Yeah.
So,
and I think it's just I think it's just assurance for people. You know, they what can they do, and how soon can they get to see someone as well. You know, so it just I think we've been. I think the more communication we have with patients, the better.
Yeah.
You know, we do you want people going to us? Or going into the local pharmacy. I think we can provide the care. I think we would duty to do it. Yeah,
absolutely. Good. So no plans for a third practice then?
There might be.
Good.
We've recently joined a group, Invisalign group. So it's a big Invisalign group in Ireland. So there might be something, a little joint venture there. Maybe we can expand another little bit.
See what happens.
Yeah.
Excellent. So how many staff are with you on this trip then? How many?
There are 10.
10. Okay.
Yeah.
And is it a meal, drinks? What's happening?
They're all arriving early in the morning, so we're going to have lunch in town.
Okay.
Then back to freshen up, and then we're going out. I think we're going to a Latino nightclub or restaurant, and my Scottish girl.
She's arranged it all.
So we're in her hands.
Okay, good. And then flying back, I take it it's not an early flight?
No, Sunday evening.
That's quite sensible. And I hope you have a wonderful time in Glasgow and enjoy yourself.
Yes.
And it's been a real pleasure speaking to you.
Well, thank you. It's always lovely to visit the clinic here.
Thank you.
You've got a super setup here. It's great.
Thank you, and I look forward to, with interest, kind of hearing what happens next, and with the ventures and what's going on. It's fascinating. So, thank you very much.
Okay.
Thank you.